This is Mungu Main Street in southwest Zambia, a bustling, lively street, but it's no place to be sick. Zambia's health service is close to collapse. Its health workers, in particular its nurses, have left their profession in their thousands. At root, an HIV/AIDS pandemic is infecting over 1.5 million people out of a population of 10 million. And health workers are in the front line. Nurses in particular are critical. They comprise over 70% of all health professionals. Yet their numbers are half the government's minimum level.
The human resource crisis in Zambia has reached alarming levels in that most of our health centers in the country are operating at less than 50% capacity in terms of staff in almost all the categories.
Nurses leave in search of work abroad, often due to low pay, but also due to low morale from the lack of the most basic equipment, such as gloves, medication, and even clean blankets.
When you just open the blanket on top, what do you find on the bed sheets? It's blood.
The remaining nurses suffer a lack of social support that force many to live in poor housing, often in just 1 or 2 rooms, together with their extended families.
Now, when you go into the rural areas, it's even worse. In some of the rural areas, you might just find one, maybe environmental specialist manning a health center and doing what a nurse should do, doing what a doctor should do. And in some cases, it's just not that, it's not just available, it's just nobody, it's closed.
Despite the hardships, many nurses do not want to leave friends, family and culture. It's often a last resort. Compared to many in Zambia, Inonge is lucky. She is HIV positive, but recently gained free access to life-preserving antiretroviral drugs, or ARVs. And together with many nurses who are sick and in need, she has support from a project set up by the Zambian Nurses Association, together with help from the Norwegian Nurses Association, caring for the caregivers.
When we started the project, there were nearly no nurses on HIV medication, the so-called ARV, antiretroviral medication. Now, 3 years down the road, we've been educating the nurses. The Ministry of Health has been rolling out free treatment, and together we find that we have nearly 400 nurses on ARV treatment. These are HIV positive nurses. Many of them were on the brink of death. Today they're not only just healthy, but they're back in the workforce, putting in a 40-hour work week.
Inonge is a nurse at the Lewanika General Hospital in Mungu. There is a great stigma in becoming HIV positive, especially among nurses, something Inonge has had to fight to overcome.
When one is tested positive, they will think I was just a prostitute and all sorts of things. Plus the family affairs also. The family, when somebody is affected, they don't take care of somebody. So they stigmatize that person. They discriminate, in fact. They don't want to share anything with her. They don't want even to take care of her. And they think maybe HIV is there, it's death. That's what they think in the villages. It's grave. They didn't know there's something that can help somebody to live longer. Some die before time because of that fear.
Today, Inonge is working at the HIV clinic, testing patients for the virus. She is just one of the 6,000 nurses treating 500,000 new cases of HIV infection every year. Moena is 19 years old. She is her first patient of the day. 1 in 6 Zambians carry the HIV virus. Inonge has already had a counselling session with Moena. Inonge asks Moena to come back in a couple of hours, once the lab tests are complete.
Do other things.
Olive Ngandu is the Zambia Nurses Project Coordinator for the Caring for the Caregivers program. She is conducting a workshop for nurses at Lewanika Hospital.
Nurses had no knowledge at all in the area of HIV/AIDS, none at all. And then when we started, we concentrated on the junior nurses. The nurse managers now found that the juniors had more knowledge than them, the senior nurse managers. Indeed, when we held the first senior nurses workshop, the knowledge was very bad. They didn't know the mode of entry, what is HIV/AIDS.
The key aspects for the Caring for the Caregivers project is to provide knowledge about HIV/AIDS, updated knowledge, is to help the nurses in lobbying Ministry of Health to improve the working environment, to give them a safe environment to work in so that they can do their work in a professional manner. It's concerned with counseling about HIV/AIDS, it's concerned with treatment, and it's concerned with salary levels.
This is called determining test. What we do, we just take a sample, because it has been separated from blood to serum. Then we take 2 drops from here, we put it in the patch. This one, it means that the client is negative, because there's only one line there. No? In this one, because this one means the client is positive, because there's 2 lines there, this one and the other one. So this one is positive, this one is negative. So far we have tested 14 clients, and out of 14, 10 are positive and 4 are negative.
Morena is back for her results. Inonge has to double-check the forms to make sure there's no mistake. She gives her the news. She's tested positive. Inonge explains the importance of using a condom, but reassures Morena by telling her that she too has the illness and how she has coped.
You know, when one is tested positive, they think it's the end of their life. And when they see me, who has been tested positively, living positively, doing all sorts of work, they are encouraged also to do the same. Living with HIV is not the end of everything. A virus is like any other disease. People have been living with that disease for some years and years. As long as one keeps himself fit, you eat nicely, you mix with other people, you enjoy life, and you continue with life. There's no problem. When time comes, you die. Everybody's going to die.
This year's World Health Day celebrates the centrality of the health worker to the health system. And it's really recognition that the health worker is a vital component of what makes or what does not make health systems work.